Hello, this is your Congressman Michael Burgess. This year, our nation's healthcare system has been a trending topic in the news. As a physician and as the chairman of the Energy and Commerce Health Subcommittee, I have the privilege of leading a portion of Congress's efforts on this issue. Over the last 2 years, House Republicans have been working to improve healthcare coverage for Americans. An important way to do that is through the private market. Since President Trump took office, you've seen encouraging economic growth. But what does that mean for health insurance? When more Americans are working, more American families have access to employer-sponsored health insurance. In fact, since January of 2017, the number of Americans in employer health coverage has increased by more than 2.5 million. Employer-sponsored health insurance coverage is far better than any Obamacare market plan or any possible government-mandated insurance plan. In this case, Americans with pre-existing conditions are covered under protections first enacted by the Employee Retirement Income Security Act of 1974. That's not a misprint, 1974. 40 years before Obamacare, employer-sponsored health insurance has protected Americans with pre-existing conditions. Contrary to what you may hear in the media today, there are a greater percentage of Americans in employer-sponsored health coverage than any time since the year 2000, an incredible benefit for the American people. Here's something else you're not hearing on the news. Republicans in Congress are fighting to protect Americans with health conditions. At a time when misinformation is rampant, it's time to set the record straight. Last spring, I helped write the American Health Care Act, which passed the United States House of Representatives in May of 2017. Without a doubt, this legislation guaranteed coverage for patients with pre-existing conditions. Furthermore, some false claims about pre-existing conditions incorrectly suggest that Americans could be impacted by the proposed changes to the Affordable Care Act. This is, in fact, 100% wrong. Today, 93% of Americans are covered through an employer or a program like Medicare or Medicaid, all of whom are protected for pre-existing conditions. Of the remaining 7% of Americans in the individual market, the American Health Care Act would not have let insurers deny coverage for patients. Insurers could not cancel coverage, period. They could not exclude benefits, ever, and they could not raise premiums if the patient paid their premiums. As you can see, House Republicans are committed to creating a fair system in which all patients are protected. Unfortunately, the Senate failed to pass our legislation or any legislation offering a better option for Americans. However, the Senate can still choose to take up the American Health Care Act before the end of 2018, and I hope that they will. As Congress continues to work on advancing health care for the American people, I will keep you updated on our efforts to ensure that health care works for all Americans. As always, I appreciate your comments, your questions on this issue or any other issue. May God bless you and your family, and as the song says, God bless you, Texas.